and welcome to UPfront. This evening, we have summoned the Ghana Health Service to answer all your questions about the health service delivery in the Republic of Ghana after a recent wave of several complaints of patients having been abandoned and having negligent conduct by health officials in the country. The health service ought to give us some answers as to the way forward, what is being done. The Director General is my guest. But before that, we know that what's currently the biggest story in the Republic of Ghana is that the President has suspended from office the Deputy Minister of Youth and Sports, Pius Enam Hajide, as well as the Acting Director General of the National Sports Authority, Robert Safo Mensah. The suspension, according to a statement from the Office of the President, takes immediate effect. This is in reaction to the visa scandal, which has rocked the country in the wake of the Commonwealth Games currently underway in Australia. After this break, I'll be telling you who my guest on the phone line quickly on this matter is before we settle into the matters of your health, which is very germane to our conversation today. You're welcome back. This is UPfront. My name is Raymond Alqua. And today, as I did tell you earlier on, we're focusing, sharp focus on the health service delivery system in the Republic of Ghana. The man in charge of the Ghana Health Service is my guest, the Director General, who actually is supposed to implement the renewed and fresh policies to make sure that the health service system is salvaged from the doldrums it currently finds itself, as many have complained. You do know the recent wave of complaints, right from negligence through to service delivery difficulties, to all of the many things that people complain about when they go to the various health posts across the country, is what we are supposed to resolve with the man in charge today. I did tell you about the other breaking story, which is to do with the suspension of the Deputy Minister in charge of sports, which is in the person of Pius Enam Hajide, connection with the visa scandal that has rocked our participation in the Australia Olympics. We'll be coming to that much later on when we are joined on the phone line by the authorities in charge of this particular investigation. But for now, let's settle into the conversation. Dr. Nsiasari, you're welcome.
Thank you.
I hope you are doing well this evening.
By the grace of God, I'm doing well.
The health service has recently been in the media for scrutiny and has not stood the test of time in many of these issues. Apparently, many Ghanaians have had very terrible experiences at the hospitals where they are supposed to receive care. Is the assessment on the ground by the people very different from how you guys in charge of running the service see it?
Yeah, thank you very much, and good evening to all your cherished listeners and viewers. It's true. I mean, for the past 2 or 3 weeks, health service have come on the radar. It's not very palatable reasons, but for obvious reasons that the media is very scrutinizing everything that the health service is doing. But I also quickly add that for the past months, the health service has also done a lot of useful and very good things. What I would say is that what is happening is the awareness of the media, the awareness of the people, which is good for the service. Because the saying says if you are cutting a line, you will not know unless somebody tells you that your back is crooked. And that's exactly what we want in the service. Tell us what is going wrong, and then we will make sure that it is done and done well. Apart from that, I think we should also look at other good things that we are doing. And what we are always doing is that we are doing what we call continuous quality improvement in the health sector. We have systems in place where we will continuously be improving our services, making sure that the professionals who are working are well trained, and making sure that people who are also going to receive service have access to the health service, both physical access and financial access. I was thinking that all this news should not be what we should be discussing. We should be discussing yesterday was a World Health Day, where the theme was universal health coverage, everyone, everywhere. And that is what Ghana has done very well of late. If you look at what Ghana is doing, Ghana is one of the first sub-Saharan African countries which has established a well-robust national health insurance system.
Robust?
Where, yes, it's robust.
That's
robust.
That's a very bold statement.
It's a bold statement that I'm making, because within a matter of, the law was passed in 2003, and we are now 2018.
Yeah.
And we have about nearly
15 years.
About 15 years. We have about about 10 to 11 million of the population of 27 or 26 to 27 million who are active members of health insurance. It's good.
Active?
Now, yeah, those who are active. Active means that those who can access health with their health insurance card. We've passed a law where our
How does that match up with OPD attendance?
It match up, you see, if you look at the time that we were doing cash and carry and the time that health insurance started, and then the OPD attendance, there's massive increase in the OPD attendance. But we know health is very expensive. I will not also say that the health insurance has been very healthy, but health insurance going through some challenges, and we are restructuring the health insurance system.
Major challenges, you want to say?
Yeah, major challenges, maybe I would say, not because if you see a patient who is having a health insurance card, you should be able to reimburse the person who saw the patient. If you don't reimburse, it means it goes around and then quality of care will go down, all this. And that's the reason why health insurance is being structured. But what you should also take note of is that at least we have a system where people who have health insurance card can access health without out-of-pocket payment. That's the most important thing. The next thing we also should know is that, you see, Ghana is a country where...
But is it really the case? We have had so many examples where what can we even describe as co-payment is being done on the ground?
Yes, we know that co-payment, there are some illegal co-payments which is going on.
Why do you say it's illegal? It's
illegal because, you see, even though maybe the health insurance or this facility and what the patient comes in with is covered, and you take extra money, it is not monies which are being accepted that you should pay. That's why it makes it illegal. Co-payment becomes legal when it's also part of the payment mechanism. But legal.
If the people are not being paid the amount of money, as in the hospitals, what do you expect them to do?
But the money,
give you a clear example.
Money eventually are paid.
Yes, but
so if you take money from a patient who have already have health insurance, you know that you go and put in your claims, and the money is paid. Will you pay the money back to the patient? That's the question.
It's an important question, and I'm interested in the answer, except to say, for example, I have been to the Gassaut Municipal Hospital.
Yeah.
The laboratory virtually runs on payment from patients.
Yeah.
Yeah, it's because they took the decision, they could not defer consistent lack of payment to that particular unit when they needed the lab results to make important diagnosis. And this is a unit that's functioning currently, because it took a decision to do some form of co-payments on its own.
The reason I'm saying that the co-payment is okay, maybe I'll say an authorized co-payment. Because any fees that you want to charge in anywhere in this country, in any health facility, you should be given approval to do that.
Is there authorization for co-payment at any unit?
No, there's no authorization for co-payment in any unit, so far as I'm concerned. In fact, the authorization even doesn't come from the national headquarters of Ghana Health Service.
Yes.
The authorization of any sort in this country is actually done by Act of Parliament. So that's how it is. So if there's a co-payment, I will say boldly here that co-payment is not part of our payment system in this country. We are trying to do as much as possible to make sure that health insurance...
Forgive me. I mean, because I've known and used that particular health facility for a very long time, it didn't start yesterday. It's been there for more than 3 years. And it doesn't look like it will change anytime soon. It
will change very soon.
Really?
Yeah, yes. Because once you rightly said that maybe health insurance is not paying regularly. So if health insurance start paying regularly, why should the hospital charge any amount of money for medical laboratory examination being done?
The other point I want to raise with you, I mean, and we will come to the specific cases that have happened recently, but the other point I want to raise with you is health financing in this country. I was just talking about the fact that we have some 4.4 billion as budgetary allocation to the sector in the year 2018. The budgetary allocation appropriations indicate that out of that, more than half, 2.5 billion, is going into compensation, and the other point being compensation and wages specifically. You have, from government of Ghana specifically, very little amount of money going to goods and services, and also going to capital expenditure. When I look at the other side, I see that the IGF rather is where you seek to get more money for goods and services and capital expenditure. Why?
IGF is actually not for capital expenditure, it's for goods and services. IGF is actually a recovery or revolving fund you buy logistics, you buy medicines, you buy non-medical consumables, you use it on the patient, and you are reimbursed of a small markup. So if you start using IGF, if you start using the IGF for capital expenditure, then it means you are eroding your revolving fund. That's the first thing.
Yeah.
Capital expenditure is supposed to be taken care of by the government of Ghana, and as well as salaries. The question is that, yes, it's true. The physical space is not big. We are a lower level income economy. So once the capital space, the physical space increases, what it means is that then we're getting a lot of money from government to also do other things like capital expenditure and some goods and services, apart from the internally generated funds. So there's a lot of pressure on the internally generated funds. That's the reason why maybe co-payments and the rest come in. But the question is that...
But forgive me, and I know that Kolebu is not under your control in this particular case, but for an institution like Kolebu, they can meet up with IGF. But for institutions like the Gassan Municipal Hospital, which is relying heavily on what they call a national health insurance, it can hardly sustain itself as any IGF-related engagement. So the part to do with goods and services coming from there will be close to being diminished in this case.
I always say that if you are big, your expenditure is also big. If you are small, your expenditure is small.
Yeah.
The same thing, if you are big, your revenue is big. If you are small, your revenue is small. It depends on your budgetary controls. So if somebody is in Ghana Municipal, I will even like it. Because I've run hospitals before. I ran hospitals when we were having cash and carry, and ran hospitals when we were having health insurance and then partly cash and carry. When I was in Comfort, 60% of my clients were all health insurance clients.
Okay.
And it was good for us, especially when we have the free maternal care. It means you won't have patients who cannot pay, who occupy your beds for a long time. But when we're having a cash and carry, sometimes we have no other way but to send the patients home and then follow them up of our social welfare people. And that's where the problem is. So I believe the best way is health insurance. That's the easiest way for you to get people coming to the hospital and also receiving what you are supposed to be used. But the most important is that it means if health insurance is paying their claims early enough, then most of the hospitals or all hospitals who are using health insurance will not have any problem. The most important thing that we are doing, especially with universal health coverage, is that anybody should not have any financial restriction before the person receives health care at any place. And the only way to go, that's what we are moving towards. The only way to do this.
With the current constraints?
Yes, we are moving towards that. And very soon, His Excellency, the President and Minister of Health will come out and tell everybody in this country what we are doing to achieve universal health coverage at the primary level as a first step towards
primary healthcare.
Yeah, towards SDG 3 by the year 2030. And we are doing everything possible to make sure that at least for the primary level, as the CHIPS, health centers, and the maternity homes, which is the lowest level of healthcare, we will achieve universal health coverage, which means that patients can go there, will not have any financial restriction, and they will then get a place to go and receive the basic health care without any problems. This is exactly what we want to do. And I can assure you that very soon we'll achieve that one.
Okay, so Doc, I want to be clear in my mind on exactly what's going to happen in the coming years. But the other issue that's very fundamental now is, first and foremost, there are specific cases that have come up that's questioning the robust nature of the health service delivery system. The first one is the recent Senchi issue. Of course, we know there's a probe into it. What has been determined so far in this probe?
Normally, I was just speaking to one of your sister stations some few minutes ago. I don't want to give out any piecemeal information, especially when we set up a committee of inquiry to go into investigation of things like what happened in New Senchi Hospital Health Center. So if you can bear with me and leave us for some few days or few weeks, we will come out of the total investigation, the result of the total investigation that we have done at New Senchi Hospital, and everybody will know what happened there.
How many days?
I won't tell you the time today. but very, very soon.
Is it this week?
I say very, very soon. We are getting there. You see, I don't want...
Because there's a complaint that, I mean, some of these cases happen, you just tell us that you're investigating, and at the end of the day, we hear nothing from the investigation.
No, it is, you see, it's not totally true. You know, in the health service, in the health sector, there are 3 different ways that anybody who is not happy with the system that he went through can seek redress. 1, you can seek administrative redress from, for example, Ghana Health Service headquarters that we have set up investigation. If it is a criminal offense, the law enforcement agency will also come in. And the third one is that all healthcare professionals have what we call the regulatory bodies. We have the Medical and Dental Council, which regulates doctors. We have Nurse and Midwifery Council, which regulates midwives and nurses. We have the Allied Health, who regulates the other allied health professionals like laboratory. We have the Pharmacy Council, who regulates the pharmacy council, and the Psychological Council, which also regulates the psychological health professionals. So every patient who goes into any hospital, or a relative of a patient, if he's not happy with what he or she went through, can access this type of redress system. We can also walk to any hospital. The hospitals have got hospital management in place. If you go to any hospital, you see name tags written around the place, matron's office, medical superintendent, pharmacy in charge, and the rest. So if you have any problem, just walk through. And if you feel that you are not satisfied with what is happening, you can also approach the district health directorate or the regional health directorate, or for that matter, to the headquarters of the Ghana Health Service or the Ministry of Health, or even to the Honorable Minister himself, and action will be taken.
Okay, now let me come to this point. So we don't know when we are going to get a report on Senchi specifically.
It will come very, very soon.
So who are those managing Senchi currently?
Senchi is a health center, or it's managed normally by a physician assistant, assisted by nurses.
Physician assistant?
Yes.
Assisted by, is it?
Midwife, if
Okay.
there's a midwifery section, and then also by nurses.
So was there only one physician assistant there when this?
Yes, there was only one physician assistant who was there, and I'm sure the clinic has not been closed.
Okay.
So it's still running.
So which physician assistant is in charge now?
I can't tell offhand, but I know that the regional health directorate and this health directorate will make arrangements for the clinic to continuously be running.
Okay. So is this true that a retired officer was the one in charge?
Yes, that's what the information which has come to us.
Who was running in 24 hours, or the person?
He wasn't running in 24 hours. He's not a physician assistant. He's not a prescriber. He's what you call field technician.
Field technician.
Yes, the field technicians are normally, they work with the district health directorate to go around, and then when there's any problem with disease control, they also go around to find out if people are, if there's any problem, for example, like in the olden days, they were looking after skin diseases, UOS, and the rest. That's why some of them were taught those days, because there were very few nurses and very few physician assistants, very few doctors taught how to inject people. Especially, you know, in the olden days, we were treating UOS, especially with Byzantine penicillin, with a long needle. And you see, they will put some haversack at their back and go around looking for people who have got UOS and the rest in the houses, and then treat them. And we're treating UOS and all these things with penicillin, which was Byzantine penicillin, the oil-based penicillin, very painful. That's what we were doing those days. And what the information getting to us is that he retired about 5-6 years ago. And the information getting to us is that I think he stayed on. We've made first visit, because when we heard about the deaths, the Honorable Minister set up a delegation led by the Honorable Deputy Minister and my Deputy Director General and the other directors to go and find out, fact-finding, and then also go to the relatives of the deceased person and also the one who was at Akosombo Hospital to find out what was happening. They went there, came back very late in the night. So they came back with a report. The region has also investigated and given us a preliminary report. But we have set a high-level investigation committee to find out exactly what happened.
So
What
you are
went
receiving 3 different levels of reports. Your own team that went there, professionals,
yes, they've
including
given us a
politicians.
verbal report.
Secondly,
Second,
you had a report
the region,
from
yes,
the region.
has given us a report.
And yet you are doing another level of reporting.
We want to find out exactly how the officer got there, how he stayed there for some time, what he was doing there, how he was getting his medicines to give the injections, how he was getting his patients. These are all in-depth investigation that we want to do.
Okay,
and
so
then
let me take it from the beginning. I don't want to interrupt you,
yeah.
Forgive me. But what did the original report say?
Oh, the original report has told us that there was this man who was a field technician who retired and continued to stay at the place.
Was he running the place full-time, or those others who were running the place?
The physician assistant is the one who is actually in charge. So
there's a physician assistant there?
Who is in charge of the place, who was running the place. There are nurses who are running the place.
So does he run shift with this technician?
Normally health centers don't run shift. They run a full day.
Okay.
So the physician assistant, the man in question was working there, even though he has retired. So we are looking, how did he get there? Who authorized him to be there? Because if you want to take you on after you retire, there are procedures you go through.
Oh, okay.
So we are looking at all those things. That's why I'm saying that we have preliminary report, but I instructed that we should go deep into what is happening. For all you care, it's not the only place maybe it is happening. Okay. So I will use it to set example for everybody to know that you cannot allow anybody who has retired to continue working without express permission from the headquarters.
Would this be the decision of the administrator at the hospital or at a regional or a different level?
It's early days yet. That's what we are trying to find out.
I'm asking, normally, who decides who gets recruited to a health center?
It's the Director General of Ghana Health Service.
Oh, you did? At
the head office, at the headquarters. He is the only person who is authorized to give authorization that you can continue staying on. But with an express permission, even from ministry, the minister, through the minister to the Minister of Finance, because you have to be paid.
Did your predecessor do so?
I don't think so, because he's not on salary. You do only, when you do that, the person has to be on salary, because you write to.
So how was the person being paid?
That is what we are trying to find out. For example, if you sit here for 6 years and you are not being paid, questions have to be asked.
Surely be serious how that been gone by now.
Yeah, questions have to be asked. So if the person is at a place is not being paid, it means the person is remunerating himself or motivating him or herself. So you have to find out if he's doing so, how is he doing it? Because we also had information what the patient who is alive, what he went through. You know all those things. It's on paper. So we are finding out what is happening. If he was being motivated, who was encouraging him to be motivated? Was the motivation, was he sharing with somebody else? That's why maybe he was able to stay there for 5 years. Or he sneaked in there and nobody knew.
Okay.
What is the monitoring system like? What is the supervision system like? These are all the things that we have set that high-powered committee to look into, and it won't take a very long time. I give them specific time period.
What's this time period?
Oh, I gave them a very short time period.
No, when you say specific, you can just tell us. When are they supposed to submit the report? So we can follow up.
No, I said that when the report comes.
Yes, we want to follow up. No, we want to follow up now.
Know. You'll be one of the first people to know because you brought out the story.
I hear you, but let me get to this particular point too. It's related to this.
Yes.
This field technician that we are talking about today,
yes.
Where is he?
I understand they were picked up here. Yes. The physician assistant who is in charge of the place were picked up and they were put in police cells, and I understand they were taken to court. Okay. The following, I think, 48 hours and remanded. That's what I've heard.
But how is it that they are being somewhat prosecuted when you are still doing investigations?
No, we are doing administrative investigation. We are not doing the criminal aspect of it. So that's what I always...
So we have established that the cause of death is from him.
That's what I think from... I don't know what the police established.
Okay.
Because we have not taken any police statement from them. But we went... our investigation team went to the police, and the police said that yes, they've picked them up.
Okay.
And we all heard that they went to court in Koforidua, and they remanded, I think, till 25th or so.
I get your point.
Yes.
Now, let me ask this question. The question is from the Physician Assistants Association of Ghana. They are very worried that one of their own has been picked up when he's sacrificing very hard working day and night to help the state.
Yes. If I'm also part of the association, I'll also be worried.
Yes, but they asked for his release, or they will embark on a massive demonstration.
I think that's what I just read it, and somebody just told me. I think that's somewhere that I have to speak to the president. You see, if somebody is facing
the president of the association or
the president of the association.
Oh, okay.
I know him. So
but can they do that?
I'm not too sure. I don't know. They haven't written officially to us.
To your office.
But you see, if
I want to find out from
something is in court.
Yes, I know the matter is in court, but let me get this point clarified. Are they not part of those of you who provide essential services?
Yes, they are part of the essential services.
Can they suo moto decide to go on strike or demonstration when even they are providers of essential service under the circumstance?
That one I cannot say yes or no.
But
you see,
what they call it,
because if they want to go,
if
they want to, yes, the procedure is that no.
Yes.
If they want to go on strike, they should even inform us.
Yeah.
But I just read it. What I read on the social media, I didn't see any name under it, but they are referring to the president.
Yes.
The president, I know the president very well. I have his number, and I'll call him because the problem, I've spoken to him before, and I think the problem is that, you see, there are two issues. There's an administrative aspect of it, and there is now a legal aspect of it. I understand he has a lawyer. So all what the lawyer has to maybe advise them, and then all that the lawyer has to do is to put up a case. And I think if all of us sitting down here, one day, if you're not very careful, you find yourself at the wrong side of the law.
Okay.
You may be put in remand or in the police. It doesn't mean your children and wife will say, oh, why you put in the police? You have to go and then say that, no, you are not part of it.
But you are 48 hours. I don't know. I mean, this is a very serious matter. You are 48 hours.
Yes.
It's the tendency that virtually all help centers across the country will be shut down is there.
We are going to discuss the issues with them. I'll start the discussion. I just read it this evening, and that's what I'm going to do.
So what's your first message to them? They should hold back until you hold a discussion with them?
Yes, that's the first message I'll tell them, that they should hold on, and then we will discuss it with them. And we'll also try and then engage his lawyer and discuss it with him, because the lawyers know what to do when somebody is on police remand or court remand.
Okay, now let's move beyond Senchi. And one question I'm still asking, I'm not getting an answer to, and I'm repeating because I want to know when finality will be brought to this matter. When do you expect the report? Oh,
I'm expecting the report in the shortest possible time.
That's the same answer you give me. I want an answer that says 1 week, 2 weeks, a month.
No, when I set up the committee, I gave them 2 weeks.
2 weeks, which was when?
I think it was. I gave them 2 weeks.
But it looks like the time has expired.
And the time it started expired. No. When did the case happen?
So it's 2 weeks ago.
Yes.
Yes.
But I said that there were preliminary investigations.
So when did you do
after
the
preliminary? What do I do the committee?
When did you put together the committee?
It's 2 weeks has not come. Don't worry.
Okay. When is the 2 weeks? That's what I want to know. When is the 2
Raymond,
weeks?
I said 2 weeks has not come. When the 2 weeks come, you
it will not be difficult for us to follow with you on this one. Tell us the day.
You follow it up with me. You can call me every day to ask.
I get you. I get you. But I want to move on. I'll come back to this particular matter, but I want to move on to other matters too. Because this is not the only place. And I'll be coming to the point where even the NGOs Coalition in Health is saying that they are receiving virtually 4 every single month, 4 cases of malpractice or negligence that's led to death in some circumstances. This takes me to Kaswa, the St. Gregory Hospital. You also said that you are commissioning some regional director to take charge of the situation and file a report. Do we know what really happened at St. Gregory's Hospital?
So far, what happened is what we've all heard.
Okay.
So I also say that it's early days yet. Let us finish. I believe in finding out exactly what has happened, what went wrong, and then we deal with it. See, if you say anything, which is a hearsay, then speculation. In these matters, there's the child died.
Yeah, 9-month-old.
Yes, he died. You have to find out what was the problem, what condition did the child go to the hospital with, what was the treatment like, how long was he in the hospital, what happened, what was the cause of the death, what led to the cause of the death. I'm sure there will be a pathology report also coming out. So all these things should be put together. You see, when something like this happens, as I said earlier, aggrieved parents can resort to medical and dental counsel if it's a doctor who is involved. It can also come, they also do maybe even report if they think that there was a pure negligence. But I can tell you that if you report negligence case and it goes to court, most of the time it's referred back to the professional body to look at it, investigate it, and deliberate on it. You know, if you go to medical and dental counsel, they have a disciplinary committee, which is like a high court. Yeah. If you go there and you think that you are not well, your case was not well done, go to appeal court, not to high court again. You can take your lawyers there and go and defend yourself. So all these things are available. But if you resort to just speculations, and then everybody coming in and saying this and that, and NGOs coming in and everything, if anybody has a problem, if the NGOs say that they see 4 a day, they should report to the appropriate authorities and it will be investigated. Because we have over 6,000, there are about 16,000 health facilities across the country. And if you see anything, that's what you have to do. And I've always been saying that if you encounter any problem in any health facility, the first and foremost, you have to approach the management of the hospital. And they will listen to you.
But yet,
they will listen to you.
Sometimes, this is from me, educated, who know my rights a lot. But with a greater respect, so many of the people who go to these hospitals, they do not even know the procedures that they have to go through to get some of these issues addressed. And they have to resort to the media or external people to push and fight for them in this case. The system in the hospitals are not set up in a way that promotes the rights and human rights of people.
That's why the two of us are here today discussing this issue. We are educating the people who don't know.
Okay.
If you go to a doctor or to any prescriber or to any nurse, you have every right to ask questions and ask all the questions that you want to ask.
Okay.
And he's duty bound. We are bound by our ethics, the ethics of the profession, to give answers to our clients. We are in hospitals and in other health facilities because of the patients. If the patient don't come, you don't have any business. We are continuously taking our health workers through continuous quality improvement.
Really?
Through customer care, yes.
It doesn't look like the evidence on the ground suggests that.
Yeah, it's because that's what you use. I don't know
when
what
I open the phone lines right now.
I'm not too sure.
When I open the phone lines right now,
yes,
you'll be wowed by the outpouring of massive opposition to the conduct of these health professionals in the various institutions.
Yes. And I'm asking them that, please, if you have any problem with any health professional's attitude towards you in a hospital or any health facility, just let us know.
Okay.
So this is an education to everybody. Let us know. You see, let me tell you something. Some people go to hospital. I'm sure you're going to ask about the PML case. PML. You see, some people go to hospital, and in the consult room, a patient has entered the consult room. For example, a child. It doesn't take 5 minutes to take the history of a sick child, examine the child, and give the necessary treatment and let the patient go. It depends upon what the person has. Especially children, it takes a long time to elicit even the history from even the mother, and also elicit the signs to make a good diagnosis. When any patient stays in the consulting room for about 30 minutes, people start agitating. But if that person goes into the consulting room, he will love that the doctor stays over or him for some time.
I get the point.
But the problem is that the PML case, it was in the night, isn't it? Sometimes you go in the night and then you see a lot of patients sitting out there in the night waiting for a doctor. Nights are for emergencies. Nights are for emergencies.
Because they went in the day and they were not taken care of.
Yes. If they were not taken care of, you should then find out why they were not taken care of.
Because there are many patients, there are few doctors.
Yes.
That's
if you have so many patients, and the doctors there are about 5, who are seeing about 500 patients, it means every doctor who is there in the morning is seeing about 100 patients averagely. It's humanly impossible. So they have to maybe see the patient. In fact, the maximum that you see effectively over a period of time when you are on duty, if any doctor sees more than 50 patients, then it means there's something wrong. So we are in a country where we don't have the adequate number of doctors in the system.
I'll come to that in a second, but I need to get this point out. One, when do we expect the Kasua St. Gregory Hospital report for us to see what's happened, what really happened?
Very, very soon.
No.
Raymond, you are always
this time around.
Raymond, you are asking me.
A specific date.
Raymond, you are asking me. I won't give you a date.
The Director General of the Ghana Health Service.
It can come tomorrow. It can come. It can come next day.
How many days were they given to put
it? It can come tomorrow. It can come today.
Doc, you are very forthright.
That's what I'm saying.
You are known to stay the fast as supposed to be the case.
Raymond, I have an initial report.
So from
but
there,
I won't put it out today.
You have an initial report?
Yes, but I won't put it out today.
I'm not asking you to put it out.
We are working
I'm asking you to tell me one part of that report.
We are working together. I know when, at the age of the child, I know when the child went in, I know the treatment they gave to the child, I know the diagnosis of the child.
But
I know what happened before when the child died and all what. I know it. But we have to make sure
was it related to the nose, what do you call it, the oxygen provision?
I won't tell you yes or no.
No.
The reason why I say I won't tell you is that we are doing further checks to find out, because this the father and the mother will tell you what they went through.
Yes.
The hospital in charge and the people who took care of the child also tell you what they went through. But we need
I get you.
Independent
are you telling me that
to tell us that this child went to the hospital with this condition, that, and that are what is supposed to be done? Were they done? There are standard operating procedures that we have to follow. So a pediatrician has been asked to join the group to find out if whatever they did was the norm. Did they go through the standard operating procedures?
Doc,
so we are working together.
I get you.
I want to ask
Christian Health Association
of Ghana.
Yes.
And then my regional health team have been briefing me every day. That's why I said that I have the interim report. But I won't give it out on this.
Are the hospital administrators, the doctors and the nurses in charge of this child's treatment contradicting the family statement?
That the child died?
No, that it was due to the disconnection of the oxygen from the child that the child died.
That's not what we are hearing. But I said that it's early days yet.
That's not what they're saying.
I said that's not what I'm hearing.
No,
but it's early days yet.
They are contradicting that.
I said it's early days yet.
Yes.
Raymond.
Are they also saying it's not because of the money?
Let me tell you something. You know that how much money did they put up?
533 Ghana cedi.
Yes.
That's what the family said the hospital was supposed to pay.
Pay for
in the child was supposed to be the
for treatment. Yes. Or for the oxygen.
For the oxygen.
I can tell you no oxygen cost 583.
No, not for a day. I mean, for the entire stay there.
How long was it there?
They were there for more than 2 weeks. And that's known.
That's what we are trying to get everything together. And we'll let you know. We won't hide anything from the media. We won't hide anything from the public. So just have patience. I don't know. You see,
if they are contradicting what the parents have told us,
I don't believe
what are they saying?
I won't tell you. Because you see, the problem is that, Raymond, somebody has said this. Somebody has also said this.
You need an independent team to put it together.
You have to bring it together.
And ascertain which one is the truth.
And then we will know what the truth is.
And so when is this report supposed to come out?
It will come out soon.
This week?
I say it will come out soon.
Next week?
It can come out even tonight or tomorrow.
Yes, I get you. But what time frame did you give them to provide this report?
Raymond.
I get you, Doc.
Raymond.
I want a time frame we give them to provide this report.
Raymond, we set a committee.
Yes, and give them a specific time frame.
And the committee will not, will give a specific time frame.
What time did they give them?
I don't have to tell you.
No, you should be able to tell me.
No, I don't have to tell you. It's not necessary.
Because, you see,
the most important thing that the committee does...
It is affirming the thinking that
the committee,
you do committees, you do reports, and these reports are always never out there.
It's not true. It is not true.
So show me with evidence that on Wednesday we can come back to you.
When you finish the report,
yes,
and then the report is not there, then you can ask me this question. But I'm telling you that it is not true.
Don't even tell us when the report is.
I'm telling you that it's not true. That we do committees and the report doesn't come out. I've been a member of the Medical and Dental Council before. We dealt with a lot of cases.
And you publish your reports.
Oh, the reports are the Medical and Dental Council.
No,
you don't have to. You don't have to publish
on the website. I can't find any of those reports.
No, don't publish the report. Don't publish reports. But there are people, doctors and nurses, who have been suspended. Who sometimes we suspend them, we cancel their certificate and all sorts of things. It happens.
Yes. Prosecuted.
It happens.
Prosecuted.
It happens.
Me, in my entire life, I've not seen a doctor prosecuted by the recommendations of the Medical and Dental
That's
Council.
why I tell you that the Disciplinary Committee of Medical and Dental Council is a high court. You can find out.
I have no problems with that. I'm saying that I've not seen
so
anybody
why do you want the
prosecuted.
prosecution?
I've not seen any doctor being put in jail because some Ghanaian recommended or complained to the Medical and Dental Council.
That's why I have to tell you that. You see, when a health professional does something wrong,
they get to go free.
They don't go free. There are aspects of the
That's why they act with impunity.
No, please.
Benny have said so. I mean, it's not without doubt that Ghanaians know that they act with impunity.
It's not true.
Really?
It is. Nobody has impunity.
That,
they
for
are
example,
very hard
have you heard this complaint before?
They are very hard-working.
People go to them, tell me my disease condition, they ignore all of those questions, they treat them anyhow because they believe that they are in short supply, and you are less likely to even punish them when they go wrong anyway.
It is not true.
Well, the way I'm saying it's not true. There's no evidence to suggest otherwise.
You see, I have been a hospital in charge before.
Yes.
I have punished doctors before on my own as a hospital manager.
You give a suspension for a week, 1 month.
As a hospital manager.
And they still take their salary.
Even more than that. More than that.
And they take their salary.
Not salary. More than that. We've done it.
Through your actions.
But you don't have to come and publish that Dr. So and so has been, because you see, there are a lot of there are also some wrongdoings among the media.
Yes, it's always out there.
Do you publish it where?
Yeah, it's always out there.
Have you prosecuted whom? Where?
No, but we don't do prosecution.
So,
but in this establishment,
you have the media commission.
We have recommended people for prosecution before.
Yeah, you have media commission.
And some of them are even ongoing.
You have the media commission.
Yes. It has happened so many times.
There
are so many rulings that have been out there.
The same thing, there have been so many rulings by the Disciplinary Committee of the Medical and Dental Council. There have been so many rulings by the Disciplinary Committee of Nurse and Midwifery Council and by Pharmacy Council.
There's somebody who sent a message earlier on the George Pamoni show. The person said that life experience when they took their parent to the Rich Hospital, their emergency center, it took them forever to just lay the bed.
To lay a bed?
Yes, just lay in the bed.
And where was the patient?
The patient was sitting there.
Where did they report to?
Oh.
And how many beds were free at the Ridge? Was it given treatment?
I mean, they did not say that there was no bed. They said that laying the bed.
I'm not holding brief for anybody. All what I'm saying is that if such thing happened, when the patient got a bed, he should have walked straight to the in charges of the hospital, the medical director or the nurse manager there, and said, today I've been here, and even laying bed took this number of hours.
If they had mercy on you to later on lay the bed, if you go and report them, they will ignore your patient completely.
Raymond, it doesn't cost anything for the patient relative or the patient to go and make this complaint. That's why I'm encouraging Ghanaians.
Okay.
I'm encouraging the general population that you have every right to make such complaints.
So you are making a commitment here that you can sanction, and you would indeed sanction erring doctors and other allied health officials who actually do not treat patients well.
Yes, and when it comes to you don't just sanction, we go through a system. We have disciplinary codes, we have patient charter, we have everything that you go according to a disciplinary code and take the necessary sanction and do the necessary sanctions.
All right, so there are two issues that have not been concluded. One, you can't tell us when the St. report is supposed to be out. You can't tell us when the Kaswa St. Gregory's
I said they were given 2 weeks.
They're giving 2 weeks.
St. was given 2 weeks.
When are they supposed to bring it, the report?
St. was given 2 weeks. It's not yet 2 weeks.
Okay, so how about the Kaswa one?
Kaswa has been given a week.
A week.
And it's not yet time.
Okay, I agree because this is this week.
Thank you.
So next week they were supposed to produce the report.
Thank you. So you can call me
next week
and then we see where we have reached.
Now, how many doctors are in the country?
Registered doctors in the country. If I knew you asked me, because maybe I would have gotten there. But I can tell you, we have over 4,000 doctors who are on the register.
How many doctors are under the Ghana Health Service and working for government in the various hospitals?
Out of this, quite a lot number of doctors are on government payroll.
What's the percentage of the 4,000?
I cannot tell you. If you have to ask me, I could give you. It's on my table.
I get your point, but I just want to know the problem. See, the crux of all of these problems is that we don't have doctors. If they were in abundance, some of the conduct that people complain of, people have choices. They can choose.
Yes, you don't have maybe enough doctors for the population. But it's better if you compare it to, for example, 1978.
It's interesting. I mean, the comparison is always
It's better.
Yes, we are supposed to move.
Yes, it's better. We are moving forward. not only doctors, we are moving also forward very nicely with even nurses, with pharmacists. Because if you know,
how many doctors are in the Upper East region?
That's where I'm coming to. We are moving forward with the doctors. What the problem we have is equitable distribution of the doctors and other health professionals. You know that the development or the infrastructural development of this country is not uniform.
Yeah.
So everybody wants to work in a comfort zone of Accra, Kumasi, the regional capital, especially in the down south. And nobody wants to go above the Black Water River. That's where the problem is. I, as a person, have always said, and I'll continue saying that everybody who finishes school, either nursing training school or the medical school or pharmacy school, has to look for a job. We will take all of them. We know we have our norms. We know the gaps. We know what's the gap in Upper East is, what the gap in Northern region is. And what I believe we should do, which we started having interviews for the doctors. But going forward, I believe, and I think that's what you should do, that every region will be given the quota according to the gap that they have. If about 275 doctors come out now with financial clearance, then we know the Upper East, the gap is maybe 15. So if you share, you cannot give them all the doctors at once. But if you share it, then we scale it down. Upper East will need about 15. This Upper West will need about 20. This one will need this. And maybe Greater Accra, where the majority of doctors are, will not have only maybe one, or they don't need it at all.
Okay.
Then people will go there. The interviews will be fixed from Monday to Friday, the same week. So if you have the vim that there's only one doctor to be employed in Greater Accra, you can come to the interview, maybe about 200, everybody wants to work Greater Accra, only one person will be taken. The following day, Tuesday, you take the next available vehicle or plane and go to Upper East. That to me is a way to make sure that people are well distributed and they go to the place where they are needed. 2, we should also have the pull factors. And pull factors, you can get it even during the interview. When you walk to WA, the regional capital, the national level will go and support them. You go there and they say that they need 15 doctors. And they say, okay, we'll take you to Gulu hospital. If I'm the one, a young man or a young woman who wants a job in WA, I'll say, please, tomorrow is Wednesday. Can I go to Gulu and go and see how the health center is? And as a regional health directorate or regional health director, I'll put you in my car, drive you on the rough roads to Gulu. The first place of call will be the district chief executive's house. I have this young man or this young woman for you as a doctor. Please, let's make him or her happy here. And if I'm the district chief executive, I'm building a point.
Yeah.
I would take you to a bungalow, or if you don't have any room for it, at the residency, I'll get a room or some quarters for you to stay there for the meantime whilst you get accommodation ready for you. And I'll ask you, we will make sure that if you want to go to Accra every month or so, I'll take you there. By the time we realize, the young man, the young woman has even coupled a baby and nurse who is there. And that's how you attract people to your place.
I get you.
And as a ministry,
this look more like...
As a ministry,
yes,
we are also working out an incentive package which will be targeted to places.
Okay.
So that if you move to Upper West Gulu, for that matter, everybody, the basic salary is, everybody receives this salary, but you get an extra money. I can tell you that every human being is motivated not even by the quantum of the money, by the respect,
Doc,
by accommodation, by extra money, which you will get more than somebody in Accra.
I get you. I want to look at the situation now. The Dafema Buzie Issa district has no doctor. The entire district.
Maybe there's no hospital there.
No,
maybe it's a health center.
Yeah.
Health centers are normally manned by,
but
except the health centers in the cities.
They are normally manned by 100,000 people.
It is not right. My own district, at Makwangma district, we don't have any public health doctor because there's no district hospital in that region, in that district. And that is my own district.
Yes, I'll come to you. After your own, they can solve it immediately because
I can't solve it immediately.
Why is it not
because
so?
Somebody has to be. We have to get somebody who will go there and go and work. That's
yes. So why are you not putting somebody
That's
there?
why my district chief executive should be listening to me now, and have the pull factors.
Oh.
Anywhere I go, I meet a regional ministers, I meet a district chief executive, and I tell them,
yes,
this is the time for you to attract young doctors.
I get your point, but I want to know whether Dafima Busiesa will get a doctor soon.
Yes.
When?
We have doctors that we are going to post. We normally send them to the region.
Do you have a doctor going to Dafima Busiesa?
It is what we will look at the gaps. If Dafima Busia Busiesa needs a doctor to be there. If you ask me, I think that every district should have at least one doctor.
Doc, is Dafima Busiesa getting a doctor?
You are telling me they don't have a doctor.
They don't. Everybody knows for a very long time.
And I'm telling you that it's not only Dafima Buzia district who doesn't have a doctor.
How many districts in the country don't have doctors?
I've mentioned my district to you.
There's
no doctor.
I said the other two. Is it the only two?
No, it's not only two. There are a lot of districts without doctors. And that's what we are going to do. We are going to do that distribution so that they all get doctors. They all get at least one doctor to look after the population of what, 140,000 or 100,000. That's what we are going to do. I can tell you, we are also having a meeting tomorrow about human resources, the redistribution and everything. And we are going to come out of all these things. And the next batch of doctors and nurses who have financial clearance, this is what is going to happen. I hope my proposal, I know that it's going to be taken, and this is the way that we are going to go. We give the people to the regions, you go there, and they will do exactly what I'm doing. And we shall encourage the district chief executives, we encourage the regional ministers to help them to have a pool and pull them and keep them, and then continuously be pulling people into their districts and their regions. And also, every young person, every young health professional wants to improve him or herself, doing postgraduate studies.
Yes, but before you go there, I've not heard you talk about training of doctors. I've not heard you talk about increasing the number of doctors by training more doctors.
We are. When I was a medical student, the only medical school, when I went to first year, was only Kolebu.
I get you, but there are so many,
but now,
about 5 of them
but now there are about 5 of them now. There are 2 privates.
But still not enough.
It's still not enough.
Yes,
ideally, if you want to have it, almost every region should have a medical school.
Yes.
So we are moving. And I think we have double or so the number of doctors in training than when I was a medical student.
Forgive me, my time is up. And thank you so much, folks, for joining us on today's edition of UPfront. We discuss the health situation in the country with the Director General of the Ghana Health Service. Thanks so much for watching.